I think ALOSA Health has always been an important part of how physicians are educated to deliver the best clinical care. But there is an urgency now that I think has arisen over the last decade, maybe even the last 5 years. It revolves around issues of opioid usage, for example. It revolves around issues of cost, so that we may be seeing that certain medications are prescribed just out of that's all the doctor knows about, or that's what the doctor feels comfortable with prescribing, when in fact there may be an equally or even more effective medication that is less expensive. And that's important. This is not cutting corners with physicians saying that's not the drug I want to use. It's saying let's look at the data. Let's look at what historically is out there. This medication may in fact be equally or better at treating your patient's hypertension, for example. And that's an important issue that we all know is so front and center in healthcare today. It also, and this is something that's not talked about a lot, it's a way, I think, to give physicians a little bit more control. Physicians are feeling like everybody else has control over their lives, and that this is a way for them to be educated and therefore communicate with whether it be insurers or other parties about why their choice of a medication is valid, has been validated by the medical literature, and that they can be strong advocates for their patients when they choose a certain medication. That they have a really a sort of foundation of saying this is not an unreasonable choice, this is why I need to go there. And I think as we see in the opioid epidemic, where there is incredible oversight happening, it will give them a very valid platform for arguing that this is an effective way of dealing with patient care. That, I think, is something that physicians feel on a daily basis, and they are frustrated by it. So this is a way to use what they have basically, like I said, from day one of medical school, learned that education and information, valid, accurate information, is a very powerful tool in the delivery of healthcare.